also oil pull. What's oil pulling? So oil pulling is using coconut oil. It's putting the oil in your mouth and it's swishing. Swish, swish. You might swish for 10, rest for 10, swish for 10 seconds, rest for 10 seconds. It's called oil pulling because it can pull waste out of the tongue. It can pull waste out of the... And don't be surprised if when you wake up tomorrow morning, the tongue doesn't feel very nice, and Wednesday morning. And there's a simple way that you can encourage the waste out of the tongue is oil pulling. And while you're on the detox, I would encourage you to try and do this maybe 2 or 3 times a day.
What if I told you that swishing oil in your mouth could remove toxins from your entire body, reduce the risk of heart disease, and even whiten your teeth, all without any fancy equipment or expensive treatments? Yes, that's Dr. Barbara O'Neill's most unusual health hack, oil pulling, which has been shocking skeptics for years with its unbelievable results. This ancient Ayurvedic practice claims to detoxify and rejuvenate your body, starting with just a tablespoon of oil. It sounds too good to be true, but the benefits might just make you a believer. Ready to explore this natural remedy? This practice, rooted in ancient Ayurvedic medicine, involves swishing a tablespoon of oil, typically coconut or sesame, in the mouth for 15-20 seconds. The thick oil mixes with and captures harmful germs and toxins in the mouth, such as bacteria, fungi, and viruses.
One last one before we finish is the tongue. And don't be surprised if when you wake up tomorrow morning, the tongue doesn't feel very nice, and Wednesday morning. And there's a simple way that you can encourage the waste out of the tongue is oil pulling. And while you're on the detox, I would encourage you to try and do this maybe 2 or 3 times a day. Just take the spoonful of coconut oil, swish it in your mouth, 10 seconds swish, 10 seconds rest for 10 minutes, and then release it out, not down, we call it the plug hole, but you call it the sink hole. Is that what you call it? Down the sink? Yeah, don't put it down there because it'll go solid and plug up our plumbing.
According to O'Neill, this process helps pull out and trap bacteria, viruses, and fungi, which are then removed when the oil is discarded. During the oil pulling process, the action of swishing is believed to activate enzymes in the oil that break down bacterial cell walls. This disruption allows the oil to trap and remove these pathogens, which can then be expelled when the oil is discarded. O'Neill points out that the detoxifying effects happen mainly in the mouth and its tissues, which often mirror the overall health of the body. The primary benefits attributed to oil pulling include reduced oral bacteria, improved gum health, and potentially lessening inflammation. Oil pulling is also said to contribute to fresher breath and may aid in reducing plaque buildup, which can lead to cavities and gum disease. Furthermore, O'Neill notes that oil pulling may influence the absorption of nutrients by reducing oral inflammation and improving gum health. This can enhance the efficiency of nutrient uptake and digestion. When oil is used in oil pulling, it interacts with the microorganisms in the mouth, creating an environment that may stop harmful bacteria from growing and help maintain a healthier mouth. According to O'Neill, oil pulling boosts oral hygiene by reducing harmful bacteria and plaque.
I'm speaking about dental health here because teeth are part of the bones. Well, they are bones. So the same thing applies to the teeth as applies to all the bones in your body. Teeth should not be deteriorating. And remember, if you have a little bit of decay, then it's important that you rinse and floss after every meal, that you oil pull maybe a couple of times a day. Just be mindful that keeping that mouth clean will prevent tooth decay and also encourage tooth healing.
The thick oil adheres to bacteria, helping remove them from the mouth, which can also lower the risk of gingivitis and gum disease. Regular oil pulling can lead to whiter teeth by lifting surface stains and reducing plaque. Coconut oil, with its antimicrobial properties, enhances this effect. O'Neill also notes that oil pulling can cut down on bad breath. By removing bacteria and food particles, it helps freshen breath and neutralize odor-causing compounds. Additionally, oil pulling stimulates saliva production, which cleanses the mouth, neutralizes acids, and strengthens enamel. O'Neill suggests that adding oil pulling to your daily routine, alongside brushing and flossing, offers a comprehensive approach to better oral health and even a brighter smile. But oil pulling is not only about mouth cleansing.
Very important to rinse, very important to floss. Both of these are even more important than cleaning with a toothbrush, but also oil pull. So oil pulling is using coconut oil. It's putting the oil in your mouth and it's swishing. Swish for 10 seconds, rest for 10 seconds. It's called oil pulling because it can pull waste out of the tongue. It can pull waste out of the glands under the tongue. It can pull waste out of the blood vessels under the tongue. And then you release that oil out on the grass. Don't release it down the plug hole or you'll plug up your plumbing. And take some water with you and rinse again and release that out. And I'm speaking about dental health here because teeth are part of the bones. Well, they are bones. So the same thing applies to the teeth as applies to all the bones in your body.
Plus, oil pulling acts as a detoxification method, extending beyond oral health to systemic body benefits. O'Neill emphasizes that this practice utilizes the oil's lipophilic properties to bind with and remove harmful substances from the oral cavity. The method, performed typically with coconut, sesame, or sunflower oil, operates on the principle that oil effectively dissolves toxins and bacteria adhering to the mucous membranes and dental surfaces. Beyond oral health, O'Neill suggests oil pulling promotes systemic detoxification. By reducing the oral bacterial load, it potentially minimizes the risk of bacteria entering the bloodstream and causing systemic inflammation. The removal of these pathogens is theorized to lessen the overall burden on the immune system, thereby improving overall health. O'Neill asserts that the detoxifying effect extends to the liver and kidneys, as the elimination of oral toxins reduces their processing load. Oil pulling is also recommended for its role in balancing the body's pH levels. Maintaining an optimal pH balance is crucial for overall wellness and can prevent conditions linked to acidity, such as inflammation and chronic disease. So, the detoxification process from oil pulling may support this balance, thereby contributing to a more neutral internal environment. Additionally, O'Neill highlights that oil pulling might improve skin health through its systemic effects. But that's not all. Oil pulling has gained attention for its potential to support detoxification and enhance overall health. One notable benefit of oil pulling is its ability to activate the lymphatic system, a crucial component of the body's detoxification and immune functions. According to Dr. O'Neill, oil pulling can significantly improve lymphatic circulation by encouraging the movement and removal of toxins through this essential network. The lymphatic system differs from the circulatory system in that it lacks a central pump. Unlike the heart, which continuously circulates blood throughout the body, the lymphatic system relies heavily on muscle contractions and external stimuli to maintain fluid flow. The movement of lymph fluid is largely dependent on physical activity, such as muscle contractions during exercise and manual actions like oil pulling. When you engage in oil pulling, you are effectively stimulating the tissues in your mouth and jaw. By improving lymphatic circulation, oil pulling helps promote the mobilization of lymph fluid. This increased flow of lymph fluid facilitates the removal of toxins from the body's tissues. The toxins that are expelled through the lymphatic system are then processed and eliminated by the body's natural detoxification pathways. This process reduces the risk of systemic inflammation and contributes to overall health. In essence, the regular practice of oil pulling could be a simple yet effective way to support your body's detoxification processes. By enhancing lymphatic flow and aiding in toxin removal, oil pulling may help maintain a balanced and healthy internal environment. Plus, this could also potentially reduce the risk of chronic health issues associated with toxin buildup and inflammation. The underlying mechanism of oil pulling is based on its capacity to trap and dissolve lipid-soluble toxins and pathogens. This method capitalizes on the fact that bacteria have a lipophilic, or fat-attracting nature, which allows them to be effectively pulled away from the teeth and gums. This action significantly contributes to improved oral hygiene by removing these unwanted elements from the mouth. Beyond just cleaning the oral cavity, oil pulling may also have implications for overall systemic health. According to O'Neill, there are studies that suggest oil pulling can lead to a reduction in systemic inflammation, which could have positive effects on various health conditions, such as diabetes and cardiovascular diseases. Additionally, research highlighted by O'Neill indicates that oil pulling might positively affect the balance of oral flora. Specifically, it may increase the proportion of beneficial bacteria, while reducing the presence of pathogenic bacteria. However, O'Neill stresses that oil pulling should be considered a supplementary practice, rather than a replacement for conventional dental hygiene routines. The potential benefits of oil pulling are supported by ongoing research, reinforcing its value as an adjunct to regular oral care practices. Dr. Barbara O'Neill emphasizes the importance of initiating your day with specific health practices to maximize their benefits. According to her expert recommendations, it is crucial to engage in certain activities first thing in the morning, before consuming any food or drink, to achieve the best possible results. This approach is designed to align with the body's natural circadian rhythms and metabolic processes, ensuring optimal effectiveness. One of O'Neill's primary recommendations is to start the day by drinking a glass of room temperature water as soon as you wake up. This simple act of hydration serves multiple purposes. It helps replenish fluids lost overnight, boosts metabolism, and facilitates the elimination of toxins that may have accumulated during sleep. By drinking water on an empty stomach, you ensure that it is absorbed efficiently and can perform its cleansing functions without interference from food or other beverages. Additionally, Dr. O'Neill advises incorporating some light stretching or movement exercises into your morning routine. Engaging in these activities before breakfast can be particularly beneficial. Light exercise helps enhance blood flow, stimulates the lymphatic system, and triggers the release of endorphins. These endorphins not only help elevate your mood, but also increase your energy levels. Exercising on an empty stomach can improve the effectiveness of your workout by allowing your body to enjoy better circulation and oxygen delivery, free from the demands of digestion. Furthermore, Dr. O'Neill highlights the importance of mindfulness or meditation practices conducted in the morning before any dietary intake. According to her, starting your day with mindfulness exercises helps to center the mind and prepares you for the day ahead. By performing these practices on an empty stomach, you can enhance focus and mental clarity, avoiding the potential distractions and discomfort that might arise from eating or drinking. This approach helps create a calm and centered mental state, setting a positive tone for the rest of your day. Finally, let's talk about the unique properties of coconut oil, particularly its natural antimicrobial benefits. Coconut oil contains lauric acid, a medium-chain fatty acid, which makes up about 50% of the oil's content. Lauric acid is a potent antimicrobial agent, capable of disrupting the lipid membranes of harmful bacteria, viruses, and fungi, leading to their destruction. This property is particularly effective against pathogens like Candida albicans, the yeast responsible for various infections, and bacteria such as Streptococcus and Staphylococcus species. Coconut oil's antimicrobial activity is not only due to lauric acid, but also other medium-chain fatty acids like capric and caprylic acid. These acids create an environment that is hostile to pathogens, inhibiting their growth and spread. Dr. O'Neill points out that the oil's effectiveness extends to the gut, where it can help balance the microbiome by reducing harmful bacteria while allowing beneficial bacteria to thrive. This makes coconut oil a valuable tool in supporting digestive health and preventing dysbiosis, a condition characterized by an imbalance in gut flora. Dr. O'Neill also highlights the oil's stability, as it is resistant to oxidation, which means it retains its antimicrobial properties even during cooking. This stability makes it a preferable option for high-heat cooking, compared to other oils that may oxidize and lose their beneficial properties. Coconut oil's ability to remain effective under heat is linked to its saturated fat content, which is predominantly composed of stable medium-chain triglycerides, MCTs. These MCTs are metabolized quickly by the liver, providing a quick source of energy without storing fat, further enhancing the oil's overall health benefits. Moreover, coconut oil's antimicrobial effects extend to topical applications. Dr. O'Neill notes its use in treating skin infections, as it can penetrate the skin's lipid layers and deliver its antimicrobial compounds directly to the site of infection. This makes it beneficial for conditions such as acne, eczema, and fungal infections like athlete's foot. Additionally, coconut oil can be used as a natural moisturizer that not only hydrates the skin, but also protects it from microbial invasion. Dr. O'Neill's preference for coconut oil is also supported by its role in oral health. Oil pulling, a traditional practice involving swishing coconut oil in the mouth, leverages its antimicrobial properties to reduce harmful bacteria in the oral cavity, particularly Streptococcus mutans, a major contributor to tooth decay. Regular use of coconut oil in this manner can help improve oral hygiene, reduce plaque buildup, and prevent gum diseases such as gingivitis. Coconut oil's effectiveness as an antimicrobial agent is further enhanced when combined with other natural substances. Dr. O'Neill mentions that mixing coconut oil with essential oils like tea tree or oregano oil can amplify its antimicrobial potency, creating a synergistic effect that is particularly useful in combating resistant strains of bacteria or fungi. This combination is often used in natural remedies for treating infections that are difficult to address with conventional treatments. Finally, we will see the procedure of producing the oil pulling. Dr. Barbara O'Neill recommends using cold-pressed, organic oils like coconut, sesame, or olive oil for this purpose. To begin, take 1 tablespoon of the chosen oil and place it in your mouth before eating or drinking anything in the morning. The oil should be held in the mouth, not swallowed, and swished around gently for 15 to 20 seconds, as we mentioned before.
Very important to rinse, very important to floss. Both of these are even more important than cleaning with a toothbrush, but also oil pull. Oil pulling is using coconut oil. It's putting the oil in your mouth and it's swishing. Swish for 10 seconds, rest for 10 seconds.
But remember, this specific time frame is critical as it allows the oil to mix with saliva, turning it into a thin, white, milky substance. The process of swishing draws out toxins and bacteria from the gums and teeth, binding them to the oil. Dr. O'Neill emphasizes the importance of not gargling or swallowing the oil at any point during the procedure to avoid ingesting toxins. After the 15-20 seconds are up, spit the oil into a trash can rather than the sink to prevent clogging pipes. Following the oil pulling, rinse your mouth thoroughly with warm water to remove any residue. Brushing your teeth afterward is also recommended to ensure all remaining toxins and oil are eliminated. This practice, according to Dr. O'Neill, can be done daily for overall oral health and to support the body's natural detoxification processes. So, what do you think about it? Are you gonna try this? If you do, tell us your experience in the comments section. And this is just one small health hack, to be honest. If you want to learn about natural, effective health hacks that work better than prescriptions and have no side effects, click on this video for detailed information. If you found this video helpful, don't forget to like, subscribe, and tap the bell for more tips on natural health.